All right, we're gonna get started. We'll try to be prompt here. I'm gonna start with a statement. I'm gonna introduce myself. I'm Mark Johnson, spokesperson for the Beetle County COVID-19 Task Force. I'd like to start with a brief update from the task force. As we move forward, the current update from the South Dakota Department of Health shows 21 positive COVID cases in Beetle County and 187 cases statewide. Beetle County now has 17 individuals who have recovered from COVID-19. As we move forward, we hear of the struggles our families, friends, and other community members face with this ugly coronavirus pandemic. Even here in rural South Dakota and our home, Beetle County. This pandemic has rocked our education community and has even hit our local elected legislator. There are similar incidents all around the country and the world. Our president earlier this week even released the harsh realities of what our country could face if we don't start taking action. This is our community. We all live here, and we are in this fight together. I don't want to drive down Dakota Avenue and see a mobile hospital sitting in Campbell Park, like the ones in Central Park in New York City. It is time to take coronavirus seriously. Our elected leaders in Beetle County COVID-19 Task Force get asked the question frequently, why hasn't the city or county applied a stay-at-home order or shut down the city? If stopping the spread is the goal, then absolutely, that would be a good action to take. However, unless that is a coordinated action applied uniformly across the country, our community would not be released from the shelter posture because risk would continue to enter our community. Instead, the next best approach is to slow the spread, and we in Huron, Beetle County, and across South Dakota have done exactly that. For those that have been following guidance, keep it up, but there's still more we can do to slow the spread. This is a call to action to all of our community members. This is an extremely ugly virus and will latch on to anyone, and it is taking a toll on everyone. There are incidents of young and healthy individuals paying the ultimate sacrifice. This virus doesn't choose which demographic makeup you are. It will latch on to you. It will latch on to anyone, and when it does, you are in for a battle. The Beetle County COVID-19 Unified Task Force wants to thank those citizens who are following the county and city ordinances, but we all can do better. Along with the ordinances passed locally, there are federal guidelines that have been issued by the President and the Center for Disease Control. We can do better with staying at home, reducing non-essential travel, minimizing trips, and maintaining our social distance while outside the home. We are in this battle as a community, and we need to flatten the curve and slow the spread of this virus. Us as citizens need to implement our action plans to keep our families safe and slow the spread of coronavirus. We don't want small little Beetle County turned into an epicenter like numerous large metropolitan areas are facing as we speak. We want to call on our employers. This is your time to make your action plan. When we hear the numbers from our government of places possibly having an 80% infection rate, think about what that does to your workforce. Think how quick this virus can spread in the workplace. If you have an employee walk into your facility not showing any symptoms for 3 days, but very contagious. If you have not already taken steps to protect your employees, now is the time. Many businesses have modified their services, encouraged teleworking for employees, enhanced sick leave policies, and furloughed employees to help keep those employees and our community safe. We're in this battle together, and Greater Huron Development has resources available. Greater Huron Development has also posted unemployment options. The Center for Disease Control and South Dakota Department of Health also have available workplace options for you. This information is also posted on the Beetle County COVID-19 Facebook page. Now is the time to act and prevent the further spread of this virus. If you're watching this and wondering what you can do to help, there are many options available for you. For those in our community looking to volunteer with any future community needs related to this pandemic, we encourage you to go to volunteerssd.gov. If volunteers are needed, they will have to be registered at this site. For those looking for volunteering options, we would ask you to reach out to your elected leaders, call the COVID-19 call center, or email covid19@huronsd.com. If you're interested in sewing masks, please contact us as well, and we'll send you the pattern. We're now going to go into our roundtable discussion. If you'd like to send questions, we encourage you to do so at this time at covid19@huronsd.com. I'd like to go around the room and introduce our panel and then give a brief little speech, and we'll go from there. Okay? We'll start with Superintendent Nebelsick.
Hi, I'm Terry Nebelsick. I serve as the superintendent for the 2,816 students in our school district and our 400 employees and our 5,000 parents. And I'll be going through some things and answering questions, but right now we have gone to distance learning, and I'll be able to explain how that works. Our parents are very in tune with how it works, but I'm sure there's community members that would be interested as well.
Dr. Josh Carr, and I am on the medical branch for the COVID-19 task force, along with my two uncles heading up the testing site and the call center.
I'm Julie Miller. I'm with the Department of Health. And I would just like to remind folks that the covid.sd.gov website that the state has been redesigned. It's much easier, friendlier to follow. So I'd really recommend that you check the website out. There are lots of updated resources on the website, some new frequently asked questions. There's information about schools providing meals for students. And there's guidance for food and beverage establishments. These are all new updates. So please, I encourage you to check out our the website there. Thank you.
My name is Elise Brock. I'm an obstetrician gynecologist here in town and also currently serving as the Chief of Staff at the Huron Regional Medical Center. I am here to answer questions as far as the medical aspects of COVID, as well as to answer any questions related to the medical community, specifically the clinic and hospitals in town, and their preparedness to deal with a surge if there is one.
Dr. Joe Carr, same as Josh. We're on the medical management team for the task force, heading up right now the call center and the testing lab.
Okay. Thank you all. Thank you for spending time with us this afternoon. I'm going to start with Julie Miller. If you could explain the tier testing for everyone, just kind of an update or the process that goes on there.
You bet. And Josh, jump in if I miss anything here. But we follow the CDC guidelines, and so we have priorities. And the top priorities that we are doing the testing for at the State Health Lab would be for those patients that are hospitalized or for our healthcare workers that have symptoms. We also, as a priority, would be any patients in a long-term care facility with symptoms, patients 65 years of age and older with symptoms, patients with underlying conditions with symptoms, and our first responders with symptoms. Josh, have I missed anyone on that?
Joe might have an update, and the military, active military and
Yes,
National
I keep
Guard.
forgetting to add that.
Yep, they were added on last requisition.
Now, the state is, or I don't want to say the state's offered this, but Avera and Sanford have started testing as well, and there's more tests that are being done on a daily basis. With that being done, is there more of an option for everyone showing symptoms to be tested?
We're still going to follow the priorities. It's important that we follow that. If there are low-risk tests that are done, they are probably the ones that are being sent out to the other clinics. The State Health Lab is doing only our priority testing.
Okay.
I can speak to this. Our lab director, Erin Scarborough, has been in touch with both the Sanford and Avera labs in Sioux Falls. In general, they are following the same CDC guidelines right now. They are both capable of running somewhere around 200 tests a day. Those tests are not free like the ones from the South Dakota Department of Health. They also have a much longer turnaround. It's taking 5 to 7 days to turn those tests around, and they are prioritizing their in-house tests and tests from their outlying or satellite clinics and facilities. So I get this question a lot about why aren't we sending more there, why aren't we testing more, and ultimately it's not proven to be effective or beneficial at this point.
Does the state know how many people have been told to complete self-isolation by their medical provider, but they haven't been able to complete the COVID-19 test?
I don't know how you would answer that type of question. I don't have a number for you for that. I would encourage people to continue to follow. If you are sick, go to the website and follow the guidelines there. There's very good guidelines on what to do for home isolation. There's no way of tracking the number of people that are doing home isolation at this time that I'm aware of.
Okay. The Department of Health is now posting recovered cases on their website, and over half, actually almost all except 4, have been updated to recovered status in Beadle County. What is the process to be considered recovered or have that status with the Department of Health?
The way that we do that is they call it the time since the illness onset and the time since recovery strategy. And this means that you would have been at least 3 days, 72 hours without fever and without taking medication to reduce fever. And at least 7 days have passed since your first symptoms, and that you're improving.
Okay.
Now, one thing too to add there, Julie, which she's right, at the call center, we have had a lot of calls with that where they're not, you hate to use the word qualifying for testing, but we're not testing them. And that's the biggest criteria that we're having them follow. So some people, we've done the math with them and said, you gotta stay home for, 2 more days or whatever. So we really have to be diligent on that, and that's where our citizens have to also be aware. It's that time frame and the 3 days of no medicine, no fever. Those are big keys before you get yourself back out into the workforce.
And I'll just add, like Julie and I had talked this morning, that's our call center has been doing the callbacks on those isolations, and there isn't a true number as far as, the people that have gone into self-isolation with testing, but that's part of that call center as well, is to make sure that they're following those guidelines and we keep up with them.
Okay. We'll move into a portion of the Dr. Cars here in the testing facility and call center that's set up. How have things been going out there?
So they've been going really well. We are a week into testing at this time, and as anything goes, you kind of get better as you go, and we've tweaked and got things a lot better in place. Our testing side, which Dr. Joe is in charge of, is going really smooth. I can have him touch on that a little bit. And our call center is going really well with the help of the teachers there, volunteering, and some of our other community members. We have a very good team in place and a very good process, so it's going really well. As far as the testing side, Dr. Joe talked to that, and then he has some information about our call center too. So
the testing has been going really well. We try to do our tests at the same time every day by appointment only, because again, you have to qualify to get tested. Once we are all geared up in our protective gear, we have the cars come in and we give them information which the call center or their healthcare providers have already gone over with them, how to manage this condition at home, things to watch out for, things to do to help themselves. And then also we instruct them, which I'll just read from what we typed up this morning. Our concern is that there may be people that aren't getting food or essential needs taken care of. So the 211 number has been set up, I think, in every state in the U.S. for people to call for assistance on what their needs are. So we hand them not only the information on how to manage themselves, but we also hand them this sheet that says 211 provides a 24/7 hotline, which is connected to a trained team that is able to provide up-to-date information. If you need any assistance finding food or basic essential needs, call 211 and you'll speak to someone who can help you. If your concerns are about your condition worsening or any healthcare questions, whether now or after you've been tested, we just can't stress enough, do not go to the emergency room. You either can call the emergency room, that number is 353-6226, or you can call the COVID call center at 353-6214, or call your healthcare provider. So the big key is we want to make sure that people don't go to the ER, because it's just a huge, as Elise can probably tell us, it's a huge thing if a COVID person comes into there and how they've got to get themselves all PPE, protected, all this, which at the testing center, we're doing that before the people come in. So we're prepared to test for those other people, and we ask that don't go to the ER, call first.
Okay. On average, how many calls are coming in on a daily basis?
We're averaging probably 12 to maybe 20 calls, somewhere in that range, anywhere from the patients with symptoms to a call this morning that someone wanted to help us with some hand sanitizer donations. So about 12 to 20 calls a day.
Okay. I believe Dr. Joe covered some of this. Are there any other services, assistance that can be provided through the call center?
Yeah, so like Dr. Joe said, that giving them the 211, and then if they're wanting to volunteer, you can call that call center as well, and we can touch base with that. So.
Okay.
And I'm assuming, but it does work now. I can hear myself. I'm assuming everybody heard the numbers. We talked about the 211, and I'll just repeat that. If you need assistance finding food, basic essentials, call that 211 number, or call the COVID hotline, call your provider. But there are definitely programs out there, and it's getting more and more pretty much each day when we meet. Wouldn't you agree, Mr. Nebelsack, that each day when we meet with the CDC from the state or with the county, more and more people are giving and offering programs that could be of assistance?
Just going to touch on something that Dr. Carr said. We do encourage everybody to call either the testing and call center, or at least call the ER. Even if you're symptomatic and you are planning on coming to the ER, it is nice to have a heads up that you're coming so that our staff can be prepared for your arrival. Many times you're actually triaged and assessed in our ambulance bay rather than coming into the ER, although we do have a negative pressure and partition set up in the ER to separate care of potentially positive COVID patients, known positive COVID patients, versus people who are coming to the ER for other reasons. Things to look out for, and I'm sure you guys are getting this information from the testing center, but if you're having trouble breathing, if you're having chest pain or pressure, if you are noticing signs of something called cyanosis, so your lips, your fingers, your feet are blue, if you're confused, if family members are noticing that you seem lethargic or you're difficult to arouse, those would all be things that you would need to come to the ER for. We just like a heads up so that we can take care of you as safely as possible.
And then even calling 911 if it's an emergency as well.
Correct.
That's a great thing. Now, one thing, like Dr. Brock had it spot on, those are things we look for. What we've all been reading, and when I've taken some calls in the call center, they talk about one of the first signs is losing sense of smell and taste. So those are things like we talked last week. Write down all the things that you're experiencing. Kind of keep a little journal so you can go through that right with whoever's on the other end of that call, because everybody's nervous when people come in to get their testing. I'm all in a hazard gear. I look like Darth Vader, so I'm assuming I scare people a little bit. So we're all a little nervous. We're all a little afraid. Write down your stuff and be aware of your symptoms so you can tell whoever's on the other end of the phone what's going on, and they can best assist you.
Okay. When somebody comes out, they get tested, how quick are they getting their results back through the testing site?
So Typically, it's been about 48 hours. Now, our last couple days, we've had a 24-hour turnaround, but it can be up to 7 days. So realizing if you don't fall into that priority level that Julie had talked about, it may be that 7 to 10 day turnaround. But right now, we've been running 24 hours and then typically 48 before that.
Okay. Is there any cost associated with?
No, there's no cost. It is through the South Dakota lab, so there's no cost associated with the testing at all.
Okay. Governor Noem earlier this week brought up rapid tests are going to be going to hot spots around the state. Has anybody heard possibly where they're going or how she's going to implement that?
Maybe Elise knows.
Yeah.
Julie and I talked this morning. We haven't had any access to those at all. So Dr. Brock may have
the
something.
hospital has put in a request for one of these machines that can do rapid testing. Ultimately, that equipment comes from the state, which comes from the federal government. So that stuff has been requested. We have no timeline on potentially when we will get that. And although I think Beadle County kind of emerged early as a potential hotspot in South Dakota in the grand scheme of things. As far as the federal government is concerned, we may not end up being a hotspot and we may not be a priority for getting that rapid testing equipment.
Okay. Dr. Brock, we hear a lot about flattening the curve and stopping the spread of COVID-19. Can you explain that flattening the curve aspect to everybody?
Sure. So epidemiologists in the United States estimate, because of how highly contagious COVID-19 is, that between 40 and 70% of the population will get this at one point or another. When we talk about flattening the curve, we're talking, I would say, about two primary goals. One is to hopefully keep the contagion on the lower end of that percentage, keep it in the 40% range as opposed to getting up to that 70%, but also stretching out the cases over a longer period of time so that we are not overwhelming our test centers, our call centers, our hospitals, and our clinics with very sick people. So I'm sure you guys have all seen this, a very steep peak where a lot of people get it in a short period of time, and it kind of overwhelms our systems and our ability to care for people, as to more of a gradual rolling South Dakota hill that is less dramatic, easier for us to keep up with.
I brought this up with Julie. What steps should an individual take if they have been told by their medical provider that they more than likely have COVID-19, but they don't meet that tier system to get tested right now?
Sure. The biggest thing is to stay at home and to self-quarantine. So that means not leaving your house at all, right? If there are other people who live in your home, ideally you would quarantine yourself in a different part of the house, a different floor, hopefully with a different bathroom. And be keeping at least 6 feet of space between you and any other people in your home. Also making sure that you are disinfecting surfaces routinely, frequently, using good hand hygiene, other things of the like. And then same as Julie said about the CDC guidelines, you can come off of quarantine, we say, when you have been at least 7 days from the onset of your first symptom and at least 3 days no fever with no medications to reduce fever, and your symptoms are resolved or dramatically improved.
We've touched on some of this already, but are there certain precautions employers should be taking to protect their workforce right now?
So this is my professional medical opinion. I will say that. I honestly believe that if we're going to get ahead of this, that all non-essential businesses should be shut down at this point. For those businesses that are essential or do not feel that they want to shut down or can shut down, then same things. So making sure that your employees are spaced far enough apart, hopefully to prevent droplet spread, that you're disinfecting surfaces aggressively, frequently, that you are screening your employees. So we do this at the hospital and all of our clinics now. Every person who comes through the door, they're asked if they have any sore throat, fever, cough, anything, and are also having their temperatures taken. And we haven't had one yet, but if somebody had symptoms or had an elevated temperature, they would get sent home. So making sure that you're doing those screening things at your place of employment.
Okay. Is there anything else that HRMC is doing right now to protect the healthcare community from COVID-19?
Yeah, so I actually have a list of these, and I'm sorry, I'm going to refer to it because I know that I have gotten a lot of questions about this, as has the hospital. So we have done various things. One of them are kind of what we're lumping together as called traffic control measures. And so there are 3 main access doors at the hospital. We are now having all of our staff come in through one so that they can be screened as they come into work. We have the emergency room that is there for emergencies, and ideally, if somebody is a suspected COVID case or a known COVID case, we're kind of rerouting them through the ambulance bay so that there's no direct contact. And then we have the main admissions door where people are coming to pay bills or coming in for routine infusions, things. They're not sick visits, so they're coming in through that door. All people who come through the hospital, employees or visitors or patients, are all being screened the same way with symptom assessment and temperatures. We have also started significantly reducing visitors. So there are 2 types of patients that are allowed to have a visitor with them in the hospital at this point. One are minor children, and they're allowed to have 1 parent or guardian with them for the entire stay, no swapping out. So if my son was admitted to the hospital, my husband or I could go with him, but we can't trade in and out. As well as laboring or OB patients. So our moms who are having babies are allowed to have 1 support person throughout their stay. There are theoretically other case-by-case situations that could warrant a visitor, and those are addressed at the time. We have, I'm sure you have heard in the community, basically we're running bare bones clinics, so anything non-essential is being deferred to a later date. All elective surgeries and procedures have been rescheduled. That is to minimize patients' risks when they're coming into the hospital of getting sick. It's also to preserve our personal protective equipment, masks, gloves, gowns, in the event that a surge happens. That's also consistent with the Surgeon General recommendations, as well as an executive order from our governor. What else? Our medical staff is meeting with the directors of all the departments, so the head of lab, the head of pharmacy, to meet twice a week. We meet on Tuesdays and Fridays to get the latest updates on what equipment we have, how many cases, what medication shortages, if there are any, those sorts of things. I already touched a little bit on the ER. We will be putting up now 2 temporary facilities very shortly. One will have somebody sitting in it to basically assess what you're even coming into the parking lot for, so to direct you, okay, this is what door you're going to go in here because you're coming in for a blood transfusion. This is what entrance you're going to go to because you're sick. We've ordered in a bunch of temporary partitions so that we can make specific areas of the hospital into negative pressure spaces to hopefully prevent contamination of areas. There's one of those areas in the ER. There's also going to be a whole unit on the medical or ICU floor, as well as a couple rooms on the OB floor. So those are going up as we speak. Maintenance is working on them, actually. All of our staff who are involved in direct patient care have now been what is called VersaFlow or PAPR trained. So Dr. Carr was talking about this kind of hazmat suit, essentially, where you look like Darth Vader. We've all been trained on how to use those, and those are stationed throughout the hospital. And then as well as N95, so really high quality masks. Those have been specially fitted for all of the people who are doing direct patient care. And then obviously moving the call center and the test center off site so that that's a more efficient process and is keeping people who are sick and need to be tested but not sick enough to warrant hospitalization out of the hospital.
Okay.
A lot of things, sorry.
That's fine.
That's good.
All right, we'll kind of switch gears. We'll talk to Terry Nebelsick from the Huron School District. Kind of got dealt a blow when school got, I don't know what I want to say, postponed, suspended temporarily, but you guys, yeah, there's a lot going on with the COVID-19 outbreak. How is your staff dealing with the changes, and how are you guys delivering education now?
Well, thank you for inviting me. You know, at first the word closed was used because that's what we're used to in a snowstorm.
Yep.
And so there's been a great evolution in terminology, but we are changed. And some of it is change that we'll see for years because of it, even when we get back to working with kids directly. But distance learning has been a focal point from kindergarten through. 12th grade, and of course we know in the post-secondary they've closed those campuses as well. And we have learned a lot about how to deliver school, a lot about how to communicate with students, and as far as getting quality work back. And we don't look like we did 2 weeks ago, and we probably don't look like we'll look in another 2 weeks, because people are really growing with this. There's been some reasons for this growth that are very helpful. Cable companies are becoming involved in making sure more students have internet. We're kind of pleasantly surprised at the percentage of families who have figured out a way for internet. One of the challenges that we have as we go to distance learning is when there are 2 or 3 children trying to learn from teachers at the same time, and they don't have the speed for the internet to handle all of those at once. So those are a bit of growing pains. But from early on, the commitment by teachers and families that we can do this has been something that's been inspiring for me to watch and appreciate.
I know you touched on some of them there. What are some of the biggest hurdles that the school districts had to overcome with this new platform of teaching?
The one that we recognize more important than anything is that schooling is a people industry. It is a part that has to do with relationships. One of the first questions that we ask when we hire a new staff member are a series of questions that we find out if they are a curriculum distributor or if they are into the human element of relationships, because without relationships, children can't grow and be whole. And so the great challenge has been to figure out in digital formats ways in order for those relationships to continue and to see joy both in the teachers and in the students. And the digital formats of Google Classrooms and Zoom and other formats that are coming available have been very, very important. But some of it is old-fashioned phone calls to make sure that we contact everyone. Each Friday we have a 2-hour meeting with all 17 people in leadership capacities, and so I'm coming off of that with fairly fresh information today, and we think we are somewhere at the 95 to 96% of contact with all students, and so that is a really, really important component of what's going on, is making sure that they know that we care, that we connect students even digitally with counselors and with principals, and that they have the personal interaction that they had when we were all together. One note that came out of this morning that I thought that I would share is that we spent some time on our mentor program, and our mentor program is when each new teacher is connected with a veteran teacher for the year in order to walk that new teacher into how all of this works. And what this has caused is reverse mentorship, because our new teachers have come in with the very, very latest in technology, and in the last 2 weeks they have become the mentors, and the rest of us have become the mentees. And so that has been a positive growth that has happened as well. Somewhere along here I want to talk about the school's role in helping all of the different things from the governor's office to Julie's office, et cetera. But your first questions were on teaching and learning, and I think that's the greatest challenge. I could not be more proud of the teaching staff. It's just not a doubt in my mind that there are more concentrated hours of new material and new ways to teach than at any time in their career, and I'm in awe watching it take place.
Has the governor's office detailed a plan that requires students to meet certain criteria with the pandemic that's going on, or how does the school rate, if a senior's met the criteria for graduation?
Someday I'll know that if I was blessed with this position or if it was a burden in this position, but I'm the president of all the superintendents and of the large school superintendents this year, and so that has given me early access to a lot of what we're doing. And in the very first week, and I was in consultation as these things took place, but a document came out from the Department of Ed that was given to all the teachers in order for the teachers to start noting how are they distributing material, how are they interacting with students, and how are they receiving that back. And in a direct question with Dr. Jones, our Secretary of Education, I said, before I go out with this, Dr. Jones, I'm gonna make a statement and see if that's true. And I said, if we document the teaching and learning that takes place, am I correct in assuming we're all done counting days? We're gonna talk about product, and we're gonna reach the end because our children reach the learning that needs to take place, and that's exactly what's happening right now.
Okay. I know the school district has stepped up. They've been providing meals or lunches and working with the positive learning atmosphere and trying to do everything through or online and so forth. And you're also providing a positive learning atmosphere for essential service workers and their children. What safeguards has the school district put in place to keep everyone safe, or is there guidance that you're received from the Department of Health, or?
Right. Well, I'd like to give a little bit of history of how we got there. I received a call from the governor's office in the first 2 or 3 days of this that really is a compliment to Huron and the can-do of our community. But the statement was made to me, and I was really able to parlay this, that because state aid is in place, because school funding is in place, we're going to have a paid workforce in communities where many people are losing their jobs. And so, Terry, would you help us to develop as many models of how that workforce can become a solution to the community's needs as possible? And so through that, they asked us to pilot an emergency care facility for emergency workers, healthcare workers. We're expanding it as we're discovering other essentials like community counseling, those kinds of things, where we could take our staff and provide a safe place for people to bring their children when both are in health care, et cetera. We've learned from that with some of our families, the most important thing we can do is make a staff member available because there are enough members of that family that are in the health care that taking that off campus can actually help us reduce the risk of community spread. But what I would share with what it looks like so people are not fooled into thinking we're helping hundreds of people right now. Right now we're at 8 families that sometime during a week receive supervised care. So the people that go in and work on that, including when I walk in each day to observe and encourage, I get my temperature checked and breathing conditions and that as we walk in. Everyone that goes in there, there's a school nurse that meets them at the door, and they have to pass that criteria. Then I observe as a third party to make sure social distancing is appropriate, and I'm quite terse when it's not as we develop that. Social distancing in schools is very difficult because they're a people business. So they're natural to be together, and so it's reteaching them that. But right now we have 8 families, so we probably have 16 or 17 children. Sometimes there's only 1 child there. Sometimes there's 3 or 4. We learned after the first week, because of a healthcare worker becoming identified, that we try to have the children from a family together but separate from another family, so we do not isolate more than 1 set of children if all of a sudden we can't accept them. So those are the safeguards that are in place there. And then with the food, this week now we have tripled, and we have served 3,000 meals this week. Wow. We do it on a Monday. We had over 1,600, and with the weather yesterday it was a little under 1,500. But there's 3 meals in each of those packages. And the first day we did that, we had to reteach ourselves about social distancing because of the rush. And so then we redesigned, and we have drive-through centers, and we have an administrator. For whatever days I'm available, so far I've been able to schedule everyone, but at mine, it's the same at all of them, but they stop 2 car lengths behind the distribution of the meals. I'm 10 feet away. They tell me how many meals they need. Then I send that information to the truck. Then the truck has it ready to go, and they're masked. And when people come up, they have to extend their arm all the way out in order to receive that meal. So we have really got the social distancing as far as we can, and then we make sure we temperature check and face mask those that are preparing the meal. We are prepared that if we ever have a glitch where we would discover that some part of the preparation and then someone in those 3 days was later identified, we can identify what portion of that meal needs to go back and take a 72-hour break before it can come back on because the packaging may have been touched or that kind of thing. So we've tried to be as careful about that as possible. then what we've decided is we've identified, the first week we just had people out of their calling to come and work, so some were at home getting paid because we hadn't called them in yet, and volunteers were on the front line. And so we identified those two areas as what we call essential services. And so we don't have many working, we run as lean as we can, but those that are working have their pay plus an essential services stipend. For doing that, they have to sign a waiver to acknowledge that they're putting themselves in harm's way and also that they're taking all the precautions that we request. And apologize if I ramble, but that's
No, it's
kind of a setup as to what we're doing.
okay. Before we go into question and answers, anything else from our panel that you would like to add?
I would just add one thing on what Mr. Nebelsek's been saying. I'm fortunate enough where I get to sit in on these meetings. I get to hear what Mr. Nebelsek has to say about the school. I get to go home. My wife's a teacher, and I get to see what he's implemented. And just as a community member, not as a doctor, not as sitting in here, I commend our teachers for the work they're doing. Terry was spot on when he said our younger teachers are teaching our older teachers the technology. My kids are home helping my wife with the technology stuff. But the biggest thing I see is how much our teachers miss those kids. And I've talked to Terry numerous times, that unconditional love, as he calls it, for these students. And you can see it. The teachers miss it. The students miss it. And we just can't thank all our community enough for all that, but certainly our teachers for taking on this load, and everybody else that's volunteering. It's greatly appreciated in our community.
Along similar lines of thanking community members, I know that the hospital and our clinics have gotten some very large donations of N95 masks, so thank you. We've also had more than 1,000 what we refer to as mask extenders sewn for us and given to us. By that we mean that when we're taking care of ill people, we really need N95 masks to protect ourselves as healthcare providers. And those are ordinarily changed every time you come into contact with a sick person, every time you leave the room. But because of the nationwide shortage of those and this being a nationwide pandemic, we're looking for ways to extend the use of those. And so these cloth masks are very helpful for that. We've also had pizza showing up and flowers and cookies and all sorts of things that has been really encouraging to us as the medical community to feel appreciated and supported through this. The one thing that I would say is nationwide, because of this, there's been a decrease in people who are donating blood, which negatively impacts all of us, including our critical access hospital. So the blood bank that serves us, they're called LifeServe, has decreased our blood bank by a little bit. We are having a blood drive on April 17th. The location of that is to be determined yet, but we would really encourage people to show up. It is going to be outside of the hospital system, and every precaution will be taken in terms of social distancing and making sure that people are healthy enough to donate blood, but that would be extremely helpful. The website to sign up for donors is www.lifeservebloodcenter.org.
Dr. Brock motivated me with the thank yous that are going on. How can we possibly feed that many people? Yes, we've got the food program, but also some incredible things like all of the meat that's being served has been provided by Dakota Provisions, and other businesses and people are stepping up because we're seeing food lines where it's the children being hungry is exponentially increasing as people lose their jobs, and so people providing the food is incredible.
Any other last thoughts before we move into questions here from the public? If you do have questions, you can email them to covid19@huronsd.com. We're gonna work our way through some of these. The first one, this is a question in regards to the testing facility and call center. Questioning, is there safeguards in place since they're in the same building, or if there's a reason why they're all together in the same building?
Yeah, so there's definitely safeguards in place. When we were setting up the facility, Scott Winiger is kind of our be-all guy. He made sure that we had safeguards in place of a what's called a dirty side and a clean side. We also have that set up in our testing bay as well. So The reason the call center and the testing site are in the same facility is because we get the calls in, a requisition form is filled out, and if that needs to be tested, we can take that requisition form in the same building directly to our test site. So just ease of access, it would be extremely difficult if it was at a separate site. Just the mobility of faxes, emails, all that would be unimaginable right now. It's so easy to just take that form over there. The precautions in place though is there is only one person that goes from the clean side to the dirty side, but never into the lab site. And then if participants are in testing, they are decontaminated before they go over to the clean side. So there is every precaution we can take, and that is why they are in the same facility, just for ease of use.
Okay. Any other thoughts on that?
No,
No.
that's,
Okay.
I would shout out to Scott Winiger, who, as we
Amazing.
discussed yesterday, when I had said something like, you know what, if we just had to run a test, I could come here and do it. And he goes, you aren't coming without me, because I got this down on how to get you ready, how to decontaminate. And I mean, it works well. And every time I'm done, there's a facility I shower in, but I get all different clothes and I go into the call center if we have to do that. So it's the Nordby exhibit hall, and thank the state for letting us use that, because it's an unbelievable building for us to be able to do this. And the way we can separate things, it's just been working great.
Okay. This question comes up frequently. I know we talked about it earlier, but we do have a statement. It's about why there isn't a actual stay-at-home order or shelter-in-place order. You know, the goal of the Beadle County COVID-19 task force is to stop the spread or slow the spread. That is our goal. However, without it being a coordinated action applied uniformly across, you know, the state or the country, we're still going to have those people that come and go. Instead, our elected leaders have taken that step in Huron and Beadle County and enacted the ordinances. A lot of our residents have decided to stay home. They are reducing their non-essential travel, and I think we've seen that. I don't want to say we're out of this by any means, but I think we've seen our numbers slow a little bit, and I think we're going in the right direction, but we do need that uniformity across the state and across the country to make a complete dent in the COVID-19. Any other thoughts from our panel on that one?
You know, this morning, I think Dr., what is it, Josh? Fauci, there we go. I think in Beadle County, we're doing really well, probably compared to a lot of counties in the state. Can we do better? Absolutely. Do we have to keep doing better? Absolutely. If we've gone, Saturday, Monday, Tuesday, Wednesday of no positives in our testing center, if our numbers look as good as what they're doing, we're getting more resolved, less active. What we're doing is definitely helping. He had said this morning that how you're going to gauge it is not by the number of positives or negatives if you're out of the woods. The realistic, sad consequences when the number of deaths start going down. And it only makes sense. If I get infected today, it might take me a week or two to really get bad, to unfortunately pass away. So once we get to that stage of our death numbers going down, then we know we're really making headway. So just because we aren't seeing a lot of positives doesn't mean we're out of the woods. We still have to diligently do what we're doing and even do it harder, because we don't want to get to a point where we're counting more deaths and stuff like that as our gauge. We want to just keep it to where, hey, we're doing good, and we're going to keep doing good.
Okay. I have a question. What is the thought process or reason for reserving the full hookup campsites on the South Dakota State Fairgrounds for individuals, medical professionals?
So that is in order for some of the nurses on staff at either the hospital or some of the clinics to self-quarantine themselves. They may be traveling nurses, or they may be nurses that are working at the hospital that don't feel safe or don't feel comfortable going back home to their loved ones. Dr. Brock, anything to add?
Yeah, I would agree. I mean, we've had no positive cases of any healthcare workers or emergency medical service providers in Huron. But I mean, I can say as a mom of a type 1 diabetic with a poor immune system, at some point, if we get a surge and I am being exposed to COVID on a daily basis, there's a high likelihood, right, that I will be quarantining away from my family just to avoid the possibility of transmitting it to them. So it's just a nice option for people who want to take advantage of it. Not that it's a necessity at this point.
Do we have any idea of when resources will be available to start testing regularly for the low risk or the low tiers?
I don't have any idea how to predict that.
Okay. This question is, what is the gauge being used to determine when to increase actions to quarantine social distancing or guarantee social distancing to prevent a surge of in COVID-19 spreading? The number of cases can't be the answer because not everyone is being tested. That's going to be, we don't have any of our elected leaders up here right now. I talked with them the other day. Everybody's different on where their tipping point would be or gauge they're going to use. If you have a question in regards to that, I'd ask you to reach out to them. It kind of goes back to that uniformity where, you know, the Huron and Beadle County leaders have enacted the ordinances that are there, but there's a lot of places around us that haven't taken any action against COVID-19 as well.
I'll share a citizen's observation on that, just from way, way too many meetings every day. The more that we can get our friends and neighbors to assume that all of us have the potential to be healthy carriers, the better chance we have of helping slow it down. So I'm just going to share these things as a possible motivator for other people to consider. But our business office is 20 feet down the arena hallway from my office, and I have not been in there in 11 days, okay? My admin assistant sits on the other side of a glass window, and everything is digital. When we communicate, I hit the intercom, and we visit that way. Anything that is being passed from one department to another sits in a basket outside, and we know which stuff has to sit there for 48 hours and which was cleaned as it came in. We have now gone to a step with all of our elementaries as they prepare these lesson packets for children, that they cannot come to the copy machine until the person who used it before has cleaned it, and then we're ready for the next person. This is the first time I've been in a room with human beings that everything wasn't a digital conversation, and we did the social distancing here to make this work. And I also had a wonderful maintenance person tell me, if you have to sit up there today, it's sanitized. So those are the careful things that are taking place. If we all assume that it's our job to make sure we don't infect someone else, then we're going to reduce what I think is the most dangerous, and that's the healthy carriers. And if we can stop the healthy carriers, I'm not a medical person at all, but that's been the commitment of our school.
Right now, what I read last night, which Terry's 100% correct, I think they're thinking, and Josh and Elise might know, like up to 25% of the cases may be due to healthy carriers, or 25% of us could be healthy carriers, however we go with that. So you got to assume you're going to pass it to somebody who's right.
That's the most up-to-date thought. I guess I would encourage people, I know there's been a lot of public outcry about this. We have elected officials for a reason, both at the local and the state level, and even higher than that at the federal level. And our own governor the other day said something about being a herd mentality. Well, we are the herd. So if you feel that it's important in our community and in our state to have a shelter-in-place order, then I think that you need to make your voice heard.
This question is probably going to be for Julie. How's the Department of Health handling individuals who are supposed to be quarantined but are not following the rules?
Yeah, that's difficult. I would say if you know, I don't know how you would know who's supposed to be quarantined in the first place, really. The Department of Health is doing a wonderful job behind the scenes of contacting every case and following up on all of their contacts. If you were a contact, you're notified to take precautions to self-monitor, and if you develop symptoms, to contact your provider. If you are wondering, none of us need to know who is positive or who is a contact, or making sure someone's been notified or someone's been contacted. We just have to assume that everyone is positive and avoid everyone, and know that the Department of Health is doing a super job in contacting those that are positive cases and staying in touch with those who are contacts. If someone is a contact but has no symptoms, we are still following up with those folks. They are placed on a text message, what they call the TIM system, and they receive a text message every day. And if they develop symptoms, then we are continuing with that case again. So we aren't forgetting about anyone. We're doing a really good job keeping track of everyone, I think.
This is a question with Beetle County having the highest transmission rate cases in total population, first to be announced community spread. I guess for the panel, do you think that Beetle County is doing their part in stopping the spread or slowing the spread?
I would just comment kind of from the call center side, and that, I mean, in having that up in a week, we went from a lot of calls to very little. I stopped out there this morning. We had 1 to 2 calls this morning. So I think just the information that has been given out, you know, from our elected leaders through the panel we had last week, from everything that's been going on, we've done our part. Is there more we can do? Absolutely. But from the observation of the call center, it has gone down quite a bit.
I think it's important to remember too that, you know, our 21 cases, the vast majority can be traced back to 2 individuals who had traveled outside of the state and or country. And so while we did emerge as an early hotspot, I don't think that has been due to lack of response on the part of the community to attempt to self-isolate and quarantine at home.
Okay.
Yeah, I would say, just from my children being able to be on social media and what other communities are doing, Beetle County should pat themselves in the back as far as the state. We're way ahead of the curve on most everything that we're preparing to, and pray to God it never gets to that big surge. But from what I've seen, from what I've done, from what I've heard, we're way ahead of the curve. So keep moving in that direction would be the thank you and the advice.
I would just add too, on our operation call this morning, with everything that's going on, we are probably one of maybe 3 sites in the state that has the testing off-site. Dr. Brock, correct me if I'm wrong, but I believe there's only 3 off-site testing facilities away from the hospital in this state, and that was a huge step to ease that burden from the hospital and to ease that stress of having those patients come into the ambulance bay to be tested. So Beetle County is way ahead of the curve on that.
Mark?
Yes.
I did talk with someone in Minnesota media, and we both evaluated what our current situations are, and he agreed that the Beetle County and Huron City ordinance is more stringent than the Minnesota stay-at-home order. If you go through everything that has been shut down in Minnesota, everything, the requirements for all their residents, Beetle County residents right now are living under a more restrictive state under that ordinance, quote-unquote restrictive, than what the state of Minnesota is under a lockdown. So Beetle County did take a very strong intentional move very early on and has done well.
I'm an audio guy. Did the audience be able to pick that up, or I paid attention to repeat it? One of our media support said that they did a cross-check with what's on the state of Minnesota compared to what we're doing countywide, and in their cross-check, they felt that we were at a more restrictive than the statewide Minnesota, which is possibly a reason that we're flattening the curve. Did I repeat that accurately? Thank you.
I have a question for Dr. Brock. Does Huron Hospital have ventilators? And at what point or what criteria does it take for somebody to be transported to Sioux Falls?
Okay. So yes, the hospital does have ventilators. We have 7 that are dedicated for adult and 1 currently that is saved for pediatrics for a baby that was born and would need some sort of ventilatory support. We have 6 ICU rooms. Right now, 4 of them are set up as negative pressure ICU rooms for COVID positive patients. The other 2 are left for people who need ICU care for other reasons, heart attacks, car accidents, other non-COVID reasons. So, you know, at any given time, theoretically, we have the potential of being able to ventilate 8 people at a time. I think that the question of when do you get transferred to Sioux Falls, do you get transferred to Sioux Falls, is a more difficult question. We are working with Sanford and Avera, more closely with Avera, as we have a telehealth contract with them to be able to phone in with their intensivists for help with ventilator management if that is needed. The reality is that right now nobody is under a surge, and so you know we have had a couple of cases that we have been able to fly out. That will become more difficult if and when the big hospitals in Sioux Falls reach their capacity with a surge. They are also, they being Sanford and Avera, planning on, if it does come to a surge, using some pretty strict criteria to determine who would be eligible for a transport. And without getting too detailed in that, it would basically be people who had a very high likelihood, if they got a more advanced level of care or a higher level of care, of surviving and coming off of a ventilator. So that is a case-by-case discussion, and it is one that moves with time depending on how many cases we're seeing and where.
Okay. I have a question. Do we know how many actual tests have been sent from Beadle County to the state health lab?
Yes, I talked to our lab director this morning, Erin, and she said that a total of 125 had been sent as of yesterday evening. So if you guys,
Yeah, we did 8 yesterday.
Yeah.
That would have counted.
Yep.
And knock on wood, I haven't had a text or anything that we're doing any testing today, so.
So 125 have been sent, 21 have come back positive.
Okay.
And our testing site goes through the HRMC lab, so those are the numbers that the testing site has too.
Yep.
Okay. There's a couple of questions in regards to large companies that are still up and operational and with the essential business that goes with it. With that, there are a lot of operations within the city of Huron and Beadle County that have been deemed essential by our federal government. So it would take an act coming from the federal level to shut some of those businesses down. But all those businesses are encouraged to be taking steps to make sure they're practicing good social distancing, along with doing their part, taking their temperature and so forth. I know a lot of them have been doing that, and that's something that we, on the backside of everything, have been working with Greater Huron Development on and encourage making sure that they are all doing that. I sit down with the mayor once or twice a day in regards, because we get this question, and we're working with Greater Huron Development to make sure we get all that information out there as well. And we've went about an hour. I do not have any more questions at this point. I would like to thank my panel for coming in and doing this today. Any last thoughts from any of you?
I'll share a thought while others warm up. I've read a lot about the echo surge, and that's when you have the success of a community really buckling down and getting it stopped, and people let up. And so I would just, as a longtime member of this community, I could not be happier with what this entire county is doing. And I just plead with people, don't let up, because working means it's working, and not that we can change what we're doing that's causing it to happen. That's all I have.
Okay.
My last comment is exactly what Mr. Nebelsick said. If we stay on that course, we're doing well. Just stay on the course.
Okay. All right. Thanks for tuning in. We're going to try to do this once a week. Maybe not with the same panel. We'll switch things up and put a different spin on it for next week. So thank you, everybody. Have a good Friday.
Thank you.